to worry about this time because the L spine has how many vertebrae? 5. That's a wonderful number compared to the, what was it, 19 that we looked at before? Now, as we know, because we're dealing with the spine, it's in the back, or what we call the posterior abdominal region, by the way, not thorax region, because where's the L spine? The lower body. Posterior abdominal region. Abdominal region. Now, what unique features are found in the L spine vertebrae that we do not see on our typical T? Well, those transverse processes, first of all, are going to be smaller than the T spine. Much more prominent on the T spine vertebrae than we see on the L. There is one new piece of anatomy that's a big one to write down. I put it in red here for you. One of those really wonderful words that I love, the pars interarticularis. Isn't that a beautiful word? I think it's just a pretty word, the pars interarticularis. I'm the only one. I'm a word nerd, what can I say? Now, what is that? That's the part of the lamina between the articular processes specifically. And we will be able to see this specifically on our oblique L spines when we start labeling the Scotty dogs. So one of those words to remember, we are going to be labeling that on our anatomy. Pars interarticularis, often mistaken for the lamina itself, but it is a separate part from the lamina. About right there, yeah. We're going to look at it closer. All right, so let's start breaking it down, and if you have that bone on your desk, you can kind of share that with your partners and take a closer look. So, once again, most of this is stuff we've seen before. Of course, that prominent anterior portion we call the body will look like a block on the x-ray when we're positioned correctly. We have that pedicle connecting the body to the transverse process. That is also the same as what we went over in the T-spine. Transverse processes, although they are smaller, they're typically in the same spot, jutting out from the sides, making that T-shape, T for transverse process. We have what's called a mammillary process. You do not need to know that one. You can cross that off of your anatomy in your book. That is a very obscure piece of anatomy we're not going to see on x-rays. But we will see the lamina, which we find between the transverse process and the spinous process. But where's that pars interarticularis? It's about right here. It's a little bit superimposed by that articular process. We're not going to so much see the pars interarticularis on the models when we see pictures like this, but we will see it very clearly on our x-rays, so keep that in mind. I'll point that out as we move forward. Now in the middle, we once again have that vertebral foramen. What is the purpose of that vertebral foramen? Are you sure?
The nerves.
For the L spine, primarily the nerves. Why? Because where does the spinal cord end? About L1. Thus, the majority of the L spine is going to use that canal to house those nerves that are going down through the trunk towards the legs. Keep that in mind. It makes great sense, yes. Now, what else we have? That superior articular process. Now, what's the purpose of that articular process? What does that do for us? What do those articular processes do? Because we have the superior and inferior. They come together to form the what?
The Z point.
The zygapopysoles or the Z-pops. We're still going to have those wonderful Z-pops. Yes, they have not gone away. We're going to be looking closer at those. We have another piece of anatomy you can cross out of your book, this accessory process. Once again, a very niche, tiny piece of anatomy we're not going to see on x-rays. So you can remove the mammillary process and accessory process from your studies unless you just want to know it. I figure you got enough to remember anyway, right?
Yeah.
You can cross those two out. All right, looking at our lateral side view, starting at the top, once again, superior articular process, which connects with the inferior articular process above it to make a zygapopyseal joint. There's our transverse process superimposed upon the side, the body from a side view. Here is our pedicle. Now the pedicle is going to be a lot more prominent on our L spines than we saw on our T. It's going to look like those little eyeballs that we talked about, those little circles. In fact, when we look at the Scotty dog, the eye of the dog is the pedicle. It literally looks like an eye, which we'll look at here in a little bit. So keep that in mind. We have right here a facet, but what I want you guys to remember that by is the inferior articular process, much like we went over on the T-spine. There is our lamina and our spinous process right here. Remember, the facet is basically just the connection point, but that entire structure is that inferior articular process. That's what you need to master and make sure you know when it comes to labeling anatomy. Why? Because we're not going to label facets on x-rays. We don't see them that well. But we can see the processes very well. Making sense so far?
Yes, sir.
Now, what do we say is different on the shape? Remember, one of the big things that changes aside from the transverse processes and the inclusion of the pars interarticularis is the shape and size of the spinous process. And if you look at those little bones on your table or those spines, that's where I always say, once again, the L spine, spinous processes look like stegosaurus fins. This is what they remind me of, or fish fins. They are more circular and wide in shape compared to those pointy T-spine and C-spine spinous processes that we learned in a previous section. There's a little bit of a closer, more clear view there. That's not in your book if you want to take a picture of that. Really pretty picture right there. Same stuff we just went over. Of course, the body, our two articular processes that come together to form our zygopompyseal joints. We also have our notches. I forgot to mention those. What's the purpose of those notches? They come together to form the what? The intervertebral foramina, correct. Are those nice pretty circles which are going to be, once again, very prominent on our L spine in comparison to what we saw on the T spine. We have our transverse process, once again, superimposed on the side, followed by that really wide fish fin, that spinous process. Or I still like calling it the stegosaurus fin myself.
Is that like texture, or are they trying to make it look like a bifid tip?
This right here,
That little line?
it's just texturing.
Okay.
It look like it's bumpy. It's not as smooth as you see in that picture right there overall. In fact, that model you have is a little more accurate to how it would look like in real life. And I do have a few more pictures, not in your book, moving on, and I'll tell you all to take some pictures of some really good reference images.
You mentioned yesterday, or I believe someone mentioned yesterday, we are able to access different hospitals' packs.
I mean, it's universal. You talking about Harris Health?
Yeah, like
They all use the same program, Synapse.
What about like GE packs and stuff like that? Like, I got some X-rays through Methodist yesterday. I forgot to mention it earlier.
How did you get that?
I-
Oh, for yourself?
Yeah.
I was like, where are you getting Methodist X-rays from? Hacking into their system over there? Like, what's going on?
I was gonna ask if we like are able to pull that up like later.
I mean,
Or-
that's your X-ray images. You're allowed to do that, yes.
Okay, cool. I wasn't
If
sure.
there's somebody else, I'd say no, but.
Yeah,
All right, we all get a picture of this, we're
I got the
good?
pictures, bro.
Move on?
Because it looks weird.
There's
It's
another
a
great
different
picture you can
type.
take there,
It's a
guys.
different format.
Once again, these vertebrae, they literally kind of act like Lego blocks that connect together. At least it reminds me of Lego blocks. This is two L vertebrae stacked on top of each other. We have the two bodies, so with between that our intervertebral disc space on the X-ray, but on a model, that's going to be the disc itself, that cushion that's going to keep those vertebrae from rubbing up against each other. There's our two notches coming together, guys. Remember the two notches, the inferior and the superior, come together to form one intervertebral foramen. So when it comes to labeling, let's assume this is L1 and L2. This will be the intervertebral foramen of L1, L2, same labeling concepts. We have the inferior articular process joining with the superior. So this would be the zygopompyseal joint of L1, L2. If we're doing it singular, inferior articular process of L1, superior of L2. So when we're talking about the landmark, it's singular. When we're talking about that entire joint, it's labeled in doubles. Same with the foramina. Notches are labeled singular. The foramen itself is labeled in pairs. Has not changed from the T and C spine. There's our two spinous processes stacked on top. They don't actually touch. Transverse processes, everything else that we've already talked about. And then, of course, those pedicles connecting the body to that transverse process area that you see right there. There's our lamina. Still can't see that pars interarticularis yet. Like I said, we're going to get to that. Yes?
Earlier you said the eye is the pedicle. Or something.
The eye of the Scotty dog, which we're going to get to that in a second. It's going to look like an eye. It's not actually an eye.
Oh.
It just looks like it. You'll see what I mean. You ever heard about the Scotty dogs yet?
We have.
Are Scotty dogs the ones that? Pardon me. Are Scotty dogs the ones that are like in poker like pictures? You know, like there's a bunch of dogs sitting around a
You
poker
know
table.
the dog from Lady in the Tramp? You ever went to Lady in the Tramp? Disney movie? The little
Yes.
Scotty dog?
The gray
with
one?
Scottish accent?
Yes.
Y'all never seen Lady in the Tramp?
I said yes.
Yeah.
I'm like, we don't see that today.
Us older. Look, us older.
Yeah, we can watch.
Scotty dog.
Yeah.
It's called a Scotty dog. It's an actual
Okay.
dog. It looks. It's a
That's it, we're
Scottish,
watching
a
that one
Scottish
today.
Terrier.
The lady in the train.
Do you know what I'm talking about? Like
I just want a second balloon.
Pull up a Scottish Terrier on your phone. You'll see what I mean. All
Don't
right,
pull it up.
another great picture, guys, just for you. We have some color coding here. If you're having trouble with this anatomy, I always recommend color coding. That's what's always helped me the most. This is a different view. We have the spinous process at the top, body at the bottom. Remember, spinous process is posterior, body is anterior. Spinous process in the orange, followed by the lamina in the purple. There's our superior articular processes, pedicles in green, and transverse processes in red on the sides there.
Is the little dot on the body, that's the pulpus? Is that what that is?
That's just texturing on the bone. So the
The center.
nucleus pulposus is in the disc, the actual disc between the vertebrae. Good question though. Yes.
This is way ahead, I mean, not
Just
way
this
ahead, but like, for the, is the L spine like the T spine when it comes to the lateral view being, yeah?
You are correct. You talk the anatomy you look at?
Yeah.
It is synonymous with the T spine, yes.
Like
The only one that's the odd one out is that C spine. It's the peculiar one, but T and L share the same anatomy depending on the position. We'll get to that. We're getting ahead.
You're talking about the foramina?
Foramina versus
Okay.
the zygapophyseals per view. By the way, I got a really great thing for y'all to help y'all remember that stuff that I found coming up later.
Thank you.
You're very welcome. One more view here, guys. If we're looking straight onto that vertebrae from the front and the back, once again, why are we doing so many of L spine? Because the registry's in love with it. We gotta know it from every view because they'll throw models like this at you on your registry. So we're looking at the posterior view at the top, anterior at the bottom. I would recommend taking a picture of this. This is not your book. Really great picture. That's that same anatomy that we went over. Now, on this posterior view, we can finally make out that pars interarticularis. It's that exact spot where that arrow is pointing right there. It's a part of the lamina, but it's a specific part of the lamina that we can only see on that posterior aspect.
So it's got this little like depression inside. Is that it?
Basically, yes. It's like a little depression. Yeah.
Is it only on the right side?
It's on the right
Or
and
the
left.
left side?
It's on both sides. And we'll see when we look at the Scotty dogs, it's a certain part of the Scotty dog that we're going to label individually versus the lamina. That'll make sense here in a little bit. So once again, the only way we can see that on a model is from that posterior view, that pars interarticularis. It is not the same as the lamina. It is a specific part of the lamina. A lot of people try to label them as the same. They are not the same. Pars interarticularis is a specific landmark located on the lamina. All right, so let's look at a couple x-rays here, guys. Look at some of the anatomy we just talked about. Here we have a nice, beautiful L-spine x-ray, which I always say is kind of like a fancy KUB, because you consider it just like a KUB. You just collimate down to the spine. Unless you have those Harris Health techs that say just leave it open, which is a silly way to take x-rays. If you ask me, do they leave their L-spines open? Or do they collimate them?
A little bit.
You know what kind of move they
They're
do.
my former students and they're not collimating. Tell them when I get them, because I used to harp on them harp on this all the time with them. An L-spine x-ray, and we'll find out when we get to positioning, it is so vital when you do spinal x-rays, guys, that you collimate. Otherwise, the rest of that tissue is going to take away from the overall quality of that image. Spine's a very thick area. We always x-rays focus on the spine by itself as much as possible. So, much easier to count, guys, compared to that T-spine. Would you agree? My best recommendation, because when you get to L5, it can get a little squirrely when it gets connected to why do I say squirrely? That's an old word. Get a little squirrely whenever you get close to that sacrum trying to find L5. So I always say go from the top. Now it's easy to start at the top. Why? All you gotta look for is that last rib. Now we know that is what vertebrae?
T12.
T12. So I just go 1, 2, 3, 4, and 5. Now once again, I recommend going from the top, not the bottom, because sometimes that L5 gets a little squished down there. It can be hard to see. But you can always nail 1 through 5, starting from the top there, guys, because the way an L-spine is centered, you're always going to see at least T1. That's part of the criteria. You have to see T1. I'm sorry, T12.
T12.
Not T1. We're not doing scoliosis. T12. T12. What else we got? Well, we can't always see these on an AP view. This is mostly dedicated to our obliques, but we can sometimes make out that inferior and superior articular process. Even though you see it labeled on this AP, I will not expect you to label that on an AP. That's too hard to see unless the quality is just top notch. But that's just showing you where they would be located in retrospect with the rest of the anatomy. Keep that in mind, because when we get to the obliques, we will label those processes and those Z-pops a lot more clear. Now we can see our spinous processes. Keep in mind, just like the T-spine, that spinous process kind of is in that inferior portion, so there's always a little bit of overlap going on there. So look closely. Here's L1. There's the spinous process of L1. You see how it kind of goes down to L2 slightly? It's a little bit long, because it's that wide shape. Don't let that throw you off. That's where it's going to be located on that inferior aspect of that vertebrae. There's, of course, our disc spaces that have not changed on the labeling. We always label that in pairs as well. So that's our L3, L4 disc space. We have our pedicles. Can you see the pedicles? I know it's labeled, but can you see them without me pointing to them? Little circles, y'all see them?
Circles, the eyes.
See our little circles? This would be our left pedicle of L2, right pedicle of L2. Please make note of that. You're going to need to label those on every one of these views we go over. We also have those psoas muscles. That's a review from an abdomen. Psoas muscles are still there. And of course, I know we're so excited, but that pelvic anatomy is coming back, guys, because we are going to talk about SI joints, which are like fancy pelvis x-rays. So of course we have our ilium, ischium, pubis areas. We have those crests. We have the ala. We have the brim. We have all those parts of the pelvis that we're going to have to review and make sure that we're mastering. And I have some slides on that as well as we move forward. Now we have the entirety of the sacrum right here. The sacrum is quite large, actually. Did you know your sacrum is this big? It's a large bone, while the coccyx is itty bitty. This is missing the coccyx. Someone nabbed my coccyx bone too. I don't know where it's at. But there is a sacrum, and y'all can pass that around and look at it.
The 5 bones.
Larger. Yeah, they fuse together to form one bone. We do have the foramina on the sacrum.
It's 5.
We're going to hit that a little later as well. We start talking about the sacrum specifically because there's actually quite a bit of anatomy on the sacrum itself. It's going to be some different stuff.
There's a lot.
Now, every once in a while, you'll get something weird like this, guys. Some people do have 6 L vertebrae. It's very rare. I think I've done 2 of these in my lifetime, but they had 6 L vertebrae. It really threw me off because you're sitting there counting. You're like, wait, 6? Oh, wait, let me recount. Oh, it is 6. Very rare. It does happen. This does not compromise quality of life. Usually just a little bit taller than other people. Just a defect. Do I have 6? Not to my knowledge. I've never had an L spine x-ray though, so I don't know.
Want to check it out? You didn't take this one, right?
I did not take this
Okay, I
one.
was
No.
about to get on you for that marking out there.
Did I take this one? You think I would leave the bra on a patient?
Hey,
You think I would turn in something that dark and ugly? Who do you think you're talking to?
You also use the digital.
Look at that lack of collimation.
Are those nippy rings?
Is that a cake?
Huh?
Oh, yeah.
Oh, yes, they are. I didn't even notice that. Yes, they are. Nipple rings? Yeah, and bra. This was a sloppy tech. Don't do that. All right, lateral view. So what are we looking at here? Still easy to count, guys. Now, on the lateral view, my best recommendation to you is to not go from the top, but from the bottom this time. Why? We can readily identify where that sacrum is. It's got that very distinct shape. And of course, that first block we see, that has to be L5. So 5, 4, 3, 2, 1, and then 12 through 10 above that. So on the AP, I recommend starting from the top. Lateral, I recommend starting from the bottom to do your counting. It's going to help you be more accurate on that.
Can you show us the last rib?
The last rib,
Like if you could do the laser,
right here. See, curving right here.
kind of.
Might be easier seeing the TV screen. Now, of course, we have our disc spaces, which we're going to label the same way. So this is an irretrievable disc space of T12 and L1. We can make out our pedicles on the lateral. It's that little connection point once again. Here's those pedicles. We're seeing those? We, of course, have our foramina, intervertebral foramen of L1, L2. And then, once again, they're going to go ahead and label these articular processes to show you where they are, but I only want you to focus on those with our obliques once again. Why? Because the lateral is focused on the foramina, not the zygapophyseal joints. That's just showing you where they would be in retrospect if you're curious. So we're going to come back to those once again when we get to those oblique views here in a little bit. Vertebral bodies, once again, spinous processes we can see. They're a little bit burnt out, but they're going to look like those big fins once again coming out the back of that spine. And then a big one here, guys, y'all should know this if you've done an L spine series because we do a dedicated view of this exact spot. It's one of our gold star anatomy joint spaces, that L5 S1 joint space. Big one right there, guys. Make sure you know what that is. We can also sometimes make out the iliac crest. In fact, you can tell you have a straight L spine, not just by the shape of the vertebrae, but how your crests look. You see a crest up here and a crest down here, it tells us what?
Centering.
Not centering. Like if I have a crest up here and a crest down here, what's
Oh,
wrong?
they're rotated.
Is they rotated. We want those
Yeah.
crests to be superimposed if they're in a true lateral. Because one thing that will mess you up on L spines, especially the lateral, is think for a second. Our X-ray tables are not the most comfortable things in the world. They're coming in for lower back pain. First off, they're laying on their back, then they're laying on their side. They're going to be doing what? Shifting weight. So I always say before you take that L spine X-ray, always do that final walk around, make sure they're on their waist properly, their back is nice and straight. Otherwise, this area's gonna be oblique while this is straight, and that's gonna mess you all up. So you need to see all those vertebrae separated. And of course, we wanna be able to see that open joint space, which we do that dedicated view on. Now, Have any of my former students shown y'all the secret Donahue trick for this L5S1 joint space? No, that is the wrong way to do it.
That's what they show
That's a
us.
sloppy way
What
to
does he
do
do?
it. Who showed you that?
These texts at here is here.
It probably wasn't one of my students, because I told them never to do
Respect when I
that.
switch it.
There
Wait,
is
what
a
is it?
special technique that I'm gonna show y'all when we get to positioning. It will nail it every single time, and every student I've ever had that
Yeah.
used it says they get it every single time on the first try. It is a fail-safe.
This is
I don't
the-
know how to explain it to you. You just move it, it depends on how it shows on the, the first one that you do, and then you move it according to that.
That's overcomplicating it.
Yeah.
There is a masterful technique I'm gonna show y'all when the time comes, so stay tuned on that.
Is it the Donahue spot?
It's the Donahue spot.
It's the hot
No,
spot.
my 2021s call it the, what do they call it? The,
Yeah, that's what they
they called it the drip dip. So they call it the drip dip. 'Cause they used to call me Dr. Drip. The drip dip, because you use your DIP joint to find the centering. The drip dip, get it?
Yeah.
I'll show y'all when the time comes. Stay tuned on that. A couple more views, guys. A little bit easier to see on these. There's our lateral and AP view of the L spine. Very badly centered, by the way. Horribly centered. But we can make out those individual vertebrae. You see how we have these really nice, beautiful square shapes and these nice, beautiful spaces? That tells us they're in a true lateral. That's what we want to see. If they are oblique or tilted in any way, we're going to see those spaces starting to close off. That's a big no-no. We want them nice and open like you see right there. Of course, there's our pedicles once again, the bodies. Spinous processes are a little burned out. You can see them better on the TV screen if you look over there. L5S1 joint space. And when it comes to the sacrum, we can call it the sacrum, or we can just simply call it S1. S1. Now, the reason we do so is because those vertebrae fuse into one single bone as we get older. So just going to be S1. And then we'll see like S1, S2, S3, S4, S5. Same with the coccyx. Coccyx will not be called C1, by the way. It's just going to be called the coccyx. It doesn't get any special treatment. Just the coccyx, not the tailbone. We not call it the tailbone anymore. That's what we called it as kids. That's what our parents always called it. Oh, watch out, don't fall, you're gonna break your tailbone. No, it's the coccyx. Tailbone will not be on your test. Do not use that term. Looking over here on the right, of course, we can still see those pedicles, spinous processes, transverse processes on the sides, disc spaces, and those sacroiliac joints down here on the bottom, which we'll do some specialized views for those too as we move forward. Making sense so far? Nothing too crazy? Pretty straightforward? All right. Okay, so that's a lateral L spine with some fusion there, guys. So when we do these laterals, once again, the start of our show on those will be those intervertebral foramina. I forgot I had some animations on here. Those intervertebral disc spaces. Oh, hang on. Yeah, I like how that works. Okay. That's showing you the spinous process on the back. There's the foramina. Which foramina is that specifically, by the way?
2 and 3.
Between 2 and 3.
That's the
5,
intervertebral.
4, 3, 2. So what is this?
2 and 3 and 3.
Intervertebral foramina of L2, L3. Now we have our intervertebral disc space. Which one specifically is that? 5, 4, 3, 2, 1. So correct intervertebral disc space of L1, L2, L1, L2. Wake your friend up over there. Just a little too comfortable.
I am awake. I'm watching.
Watching me through your eyelids, huh? That's some talent.
Don't we?
All right, our vertebral bodies, of course, guys, you can't miss those. They're those nice, pretty blocks that we see, that nice square shape. What's going to be? We want the nice square shape. If we see these spaces starting to close, what's happening once again?
Rotation.
Patient's rotated. They're not in a straight, true lateral. L5S1, of all the joint spaces you need to make sure you know, that's one of the big ones. Can't miss it though. You find that sacrum, it's between L5 and the sacrum. And once again, how do you assess that rotation? Posterior part of the body should be superimposed. Foramina should be nice and open. There's the
What do you
pedicle.
mean it's a posterior part of the body? In the picture, how can you see that it's superimposed?
Posterior part of the what?
Bodies, vertebral bodies.
Basically, that's a fancy way of saying that it needs that nice block shape, that nice square. And you'll notice, because I think I have some bad ones to show you when we're oblique or we're not in a straight lateral, the blocks get kind of distorted looking. They look funky. We want that nice, beautiful square that we see on the picture there. All right, that's that spot film. We call this an L5S1 joint space film, or a lot of texts will just refer to it as a spot film. The reason we do this is to open up the L5S1 joint space specifically. Why? Because when it comes to back injuries, it's a very common injured joint space. Happens a lot. When people fall, think about when you're falling on your bottom, it's right there close to your inferior section of your body. That joint space is gonna be what takes that impact the most. So, those of you that have done these, what do you do that's a little bit different than a regular lateral, aside from the centering aspect?
Column
You collimate, what else do you do? The little thing you gotta do with your
Angle.
two. You angle. So we're gonna add a little 5-degree angle on this towards the feet to better open that joint space. Because when you look at the lateral, it's all right, but look at how much it pops when we do that spot film correctly. It really opens up that joint space and we can get a better view, make sure nothing's broke, nothing's compromised, and it's functioning as it should.
Mr. Donahue?
Yeah.
So, could you go back to the last slide?
Oh, whoops.
Sorry.
Oh dear. Oh dear. Oh, way back. Went back to the beginning. Well, we can start over again, can't we?
Sure.
Quite a few.
So, how would the image on the right change if you added a 5-degree cephalid angle?
Good question. So, first off, we're never going to do a cephalic angle on L spines. It should always be caudad. But this would open up, the rest of these would close off because of that curvature of the spine. So it's going to be counterproductive of what you're trying to do.
Okay. And you said we do caudad instead?
We do caudad, yes. It should not be a cephalic angle. If your tech is doing that, they are incorrect. We'll look at that in the position. We're getting
For
ahead of
all the
ourselves here.
L spines.
What's up?
For all the L spines, it should be called.
For the L5S1 film specifically. All right, so there's another closer look at the same view. Once again, we have that nice angle. We're centered to that beautiful L5S1 joint space. Question?
Yeah, so regarding Jay's question, how do you know when to use cephalic or caudal angle, even though like you're telling us, so we'll know that, but like for instance,
How do you know?
sometimes, for example, like on the knee, they'll put a cephalic angle to open up the joint space, but how do we know that, like whether to use
Memorize
cephalic
it.
or caudal?
have to memorize it.
Oh,
Because it just depends on the anatomy we're looking at. It's always going to change how it lies in the body. Unfortunately, just something the guy memorized. Just so you can memorize the centering points, everything else, the degrees of angulation. It's just more of that memorization.
Also, okay. Sometimes they take a picture and they're like, "Oh, the joint space not open. Let's just put an angle on it." Even though, for example, a
They didn't have
hand.
the angle.
No, sometimes let's just say an oblique hand doesn't have an angle, and they're like, "Oh, joint space is closed. Let's just put an angle on it."
yeah.
That's just stupid. Don't do that. That's ridiculous. You never put an angle on a hand. This is in position correctly. So when some of these texts get kind of overly cheeky and creative, they just, bad habits. Don't do that stuff. Never angle on a hand. You gotta be crazy.
Well, sometimes people are like injured, like really, really bad. Like, like, well, I'm just saying because like in outpatient, like everybody has like something really wrong, like really wrong.
I'll tell you the only reason you would ever angle on a hand is if your cassette was angled. That's the way your cassette's lying, and you have to match the angle of the cassette.
Yeah, you're
Otherwise,
just.
you're
Like if they come in with trauma, they put the.
Of this
Like the
one.
portables, you know, they put them like on the bed.
Uh-huh.
Yeah.
But
Yeah.
to answer your question, Johns, that would not open the joint spaces up better for a hand. That would just distort the rest of the anatomy. You have to have the actual obliquity to open up the joints.
To the hand.
Yeah. Yes, Shamika?
I have a question, cause I've seen it to where, text, they don't do the angle, because they take the L spine and they see the joint space already open, so they be like, oh, don't do an angle, so.
They should
is
still do it.
Okay.
Because it opens up even more. See
Okay.
how open that is?
Uh-huh.
While they do it at an angle, it might still look fairly open. It's gonna just open up even better, which is what the doctor needs to see.
Okay.
As open as possible. All right, so L5S1 guys, and L4, L5 spaces are what we're looking at on this picture. There's our L5S1 with the yellow dots. There's our L4, L5 disc space. How do we assess rotation on this one? We want that greater side notch of the pelvis, which is right here, to be superimposed. That nice, pretty line we see right there. And those superimposed bodies of the vertebral superimposed boards of the vertebral body. I'm getting ahead of myself on this evaluation criteria. I apologize. That's the sciatic notch, by the way.
Where?
Right here. Sciatic notch. And what is this talking about? I forgot what this slide was. Rotated slide. Okay, I'll show you some rotation. So they call these the cake toppers of the vertebral bodies. Before I have my little outlines, y'all see how these vertebrae look like they have circles under them?
Mm-hmm.
Now it's outlined. That tells us that the patient has been rotated in that region of the body. So we want these nice straight lines that we see here. We do not want these circular aspects, otherwise the body's been rotated. So it's a big no-no. We would technically need to redo this. And look at the comparison of the space, guys. L5S1 here versus here. See how it's closed off? Once again, that's due to the rotation of the body closing off that joint space. All nicely in a true lateral. Yes?
So if that's from rotation, then what is the indication of angulation? Because I thought
Open
that those
space.
take type.
The very open space. But this may have the angulation, but because they rotated, it closed it back off.
Okay.
You have to have the combination of the true lateral with the angulation to have that fully open. All right, now let's talk about the wonderful world of the Scotty dog. This picture right here, guys. Everything we are talking about the Sky Dog, every word, every arrow, every aspect of this, you need to memorize, commit to memory, and never forget it. They will ask you multiple questions the rest of your imaging tenure. Even if you go into CT, MRI, they're going to use Scotty dogs because they love them. It's always going to be on there. And they'll refer to them as Scotty dogs. That is a scientific term. What it really is just the vertebrae joining on the oblique view. But we call them, in layman's terms, Scotty dogs. So let's look at the different parts here. This is a cartoon drawing. This is the oblique L spine on the right. Without the outline though, can you see the shape?
Yeah.
See right here?
Yeah.
See how it looks like a little dog?
The tail also.
Yeah, that's like a little tail too. We don't label the tail, but there's the outline if you can't see it. What do each of these parts of the Sky Dog indicate? Well, right here for the ear, by the way, don't label it as an ear. It's just to help you. The ear is the superior articular process. The nose is the transverse process of the vertebrae. The eye, or that circle, is the pedicle. The eye actually looks a little bigger on the x-ray. You see that? See the eye? The pars interarticularis is the neck of the Sky Dog, of this area right here. The leg right here is the inferior articular process. And the body is going to be the lamina. It's not on your diagram, but you want to label that as well. That's the lamina, the body portion. So neck is pars interarticularis, body is the lamina. Now you might be saying, well, what about the tail and this other leg? We don't label those. It's just extra anatomy that we don't, it's not significant to what we're trying to look at. Now, if you'll take notice on the obliques, because obliques are used to show the zygapophyseal joints, the zygapophyseals are formed by the ear and the leg of the dog above it. Or, once again, superior articular process and inferior articular process coming together. So, here's a zygapophyseal joint. Easier to see right here. Y'all see it? Nice pretty line. That's the zygapophyseal joint. There's the ear. There's the leg of the dog above it. And you'll notice the lower portion of the dog does go down into the corresponding vertebrae under it slightly. That's where people make mistakes. So when it comes to numbering your vertebrae on an oblique, I suggest looking at the eyes, because the eyes are in the actual vertebral body. See what I mean? So this would be 5, 4, 3, and 2. But you'll notice on 3, the feet are snipping down slightly into the vertebrae under it. Don't let that throw you off. Making sense so far? We okay?
So
I got an even better picture coming up to show you.
where did you say the spinous process was again?
You don't see the spinous process on an oblique. It's insignificant.
And where
These
do you
right
see-
here, what I told you to label, are the things that were, that's the stars of our show on this view. Yes.
You said the Z joints. They are formed by the ear and the leg?
The ear and the leg.
Okay.
Correct. Don't write ear and leg. It's just a,
So it's behind,
Help you.
it's that little space behind the ear, let's just say.
correct.
Okay.
That's the zygapophyseal joint right there. Question?
And
Jones?
the eye is hard to see on the x-ray.
Little bit, but you see that circle right here? Circle right there? The eye looks a little bigger than you see on this diagram here. See it? I got some more pictures. And, you know, everyone's anatomy is a little bit different, so.
So all the eye is the pedicel, sir.
The eye is the pedicle. A little easier to see there, huh?
If you circulate.
Gonna call it.
All right, so
They have college.
without me doing the labels yet, let's see how we can do, because we got to master these. Now, I want you to make note, your diagrams are not going to have these pretty lines on them, but we're learning to label this properly because they're going to focus a lot on this. You got to learn to label these without the pretty lines, but until you learn it, use these little lines to help you out. If I am pointing to this leg dipping down right here, what is this? Well, what's the leg though?
Inferior.
Inferior articular process. Let's assume this is L2. So inferior articular process of L2. This would be what? The ear. Inferior articular process of L3. What about this big old nose here? Snoopy. Looks like Snoopy. Transverse process. The eye would be what? What about that collar or neck?
Pairs.
Pars interarticularis.
Pars interarticularis. The body would be what? The lamina. And this leg then would be what? Inferior articular process of L3. And then of course the union of the ear and the leg is going to be what? Making sense?
Yes.
So far?
Does the opening up there have a name? Like if you go to the right of the
Right here?
zygomatic joint? Yes.
It doesn't. I mean, it's if I was to
If it
guess, it's
does.
probably the vertebral disc space area a little bit. Well, no, it's right there. I'm sorry.
The
No, it's
vertebral
insignificant.
notch.
Don't worry about it. Only worry about the ones we're labeling.
Yeah.
But here we go again, guys. Foot, inferior articular process. This picture, once I have all the labels on there, take a good picture, is a great thing to help you out. Neck, pars interarticularis. Nose, transverse process. Eye, pedicle. Ear, superior articular process. Zygapophyseal joints. And then body, lamina.
That's awesome.
Get you a good picture of that, guys.
So is it easier to see it on an X-ray or CT? The Scotty dog?
It's really x-rays. We don't really do oblique L spines for CT. We just do like a whole circular view of everything. Do like a 3D picture.
But this will teach you in CT?
That's where it's funny, you know, CT, they're just gonna throw in random x-ray stuff in there to see if you still know it. I got a lateral foot on my CT exam. Lateral foot x-ray. And they had it labeled navicular. You don't even do that in CT. They just throw them in there just for fun, because they're kind of sick like that. Everyone get a picture of this? We good?
I'm masking right now for my knee.
Now, Jay, with your artistic abilities, you can go ham on this sky dog thing. I'm just saying.
He's gonna wait till the seniors graduate.
So let me see if I can use this word properly that I learned from your seniors yesterday. So you gotta know this sky dog purr.
You said purr or?
I said purr.
Who taught you that?
Does that resonate with you young ones?
I don't know.
That's the more update way of saying period.
No.
I was told.
No, that was
That's
something,
what your
that
classmates
was something they
told me.
made up.
Yeah. I think they're messing with you.
They told me they were honest. They said purr is the new way to say period.
Nah,
Or period's still
they
used
made
too.
that up.
Yeah, I was
See,
gonna
I
say,
checked that
I'm
out.
all over Black Twitter. I've never seen
I thought he
that.
was doing blur. You know how they do the blur?
Oh, I thought
That's what I thought he was doing.
Like the rappers will.
All right, guys, let's go ahead and take our first break. It's 9 o'clock. Take 15 minutes. Be back at 9:15.
I got a question.
Where's it located? It's literally wedged between the iliac bones and the pelvis via articulations that we're going to go over called the SI joints, which stands for sacroiliac joints. Called sacroiliac because it connects to the iliac or ilium portion of the pelvis. Remember, I always say with joints, if you're having trouble with joints, almost every joint word is using the two body parts coming together. So they just kind of went crazy with the Z-pops, right? They just made a new word for that one. One of the exceptions. Now, what are our anatomic features we're going to hit? We're talking about the promontory, the canal, the foramina, and the cornu. By the way, when you look at a pelvis, you can actually still see those segments where they fuse. Thus, you see those numbers. But when we label the sacrum on an X-ray, we're just going to call it sacrum as a whole, or S1. We're not going to actually individually label all those parts, unless we were looking at a pediatric and they're all still separated. Now, at the very top of the sacrum, we have a flat portion where L5 connects. That's this right here, by the way. That's our sacral promontory. Sacral promontory at the very top. That's where L5 connects to the sacrum. In a lateral view, it kind of looks like a spiky triangle with a little horn sticking out. Bless you.
This is not the base.
No, this is the sacral promontory. Sacral promontory.
What about the middle of it?
You'll see that word base, but I want you to label it as sacral promontory. On an X-ray, you not refer to that as the base.
You said where L5 connects.
Where L5 connects to the sacrum. Now going to sorry? The top, yes, the top. Now as you go down towards the bottom, we have the apex area that's also called the sacral cornu. It's this area right here. Where you see the word apex, where it comes to a point. This is what we also call the sacral cornu. Basically, it's where the sacrum connects to the coccyx. Sacral cornu. I have another diagram showing you what that is. Sacral
It's on the.
Then we have the foramina of the sacrum. It's all those little holes. Now, thank your stars. You don't have to label those by number. There's all called sacral foramina. I guess by the time they got to that part of the body, they were tired and just quit putting numbers on stuff. That was a pretty good joke. Come on. I don't know why they didn't number them, but they don't actually number the sacral foramina. It's all called sacral foramina. So, promontory is the top, cornu is the bottom. We'll be able to see it on the lateral view. We'll show you in a second. A little bit easier. Then, so one thing to keep in mind, if we're doing anatomy labeling, and I say label a sacral foramina, you can use any of them you want. You can put that cursor on any one of them that you want. A little bit easier to label that. Now the canal really just goes down the center, but we actually can't see the canal on X-ray. So what's nice about the canal is you actually don't have to label it, just know it's there. Canal is just the central portion. Going down the middle. It's internal, that's why we're not going to label it.
Janelle, could you pass the sacrum out?
Now, when it comes to, oh, by the way, coccyx is going to have a base and a apex. We're going to look at that a little closer. So no special names for the coccyx. Top of the coccyx is the base. Bottom where it points is the apex. And then there's segments as well in the coccyx, but we're just going to call it one singular coccyx.
Mr. Donahue?
Yes.
Did you say that these were the articular processes?
Those would be the articular processes that connect to L5. Yes. We're going to look at those on another diagram in a second. All right, so when it comes to the sacrum, it does differ between males and females, as you learned about the pelvic anatomy. So it's going to be longer, narrower, more evenly curved, and more vertical in position in males than females. For what reason? For the birth canal. So males is going to point straight down. Thus, if a male was going to attempt to have a baby, that poor baby's head would get scraped on the sacrum and coccyx. It can't actually pass through. Whereas a female, it's less vertical, it's curved more posteriorly, allows that baby to travel through the brim of the pelvis more smoothly. So the female sacrum is what we call more acutely curved. Acutely curved. So sorry, males. Yeah, females have a cuter sacrum than you do. That's how you can remember that. Acutely curved. Kind of like that acute angle. Where else on the pelvis? We talked about acute before.
Oh, the pelvic outlet.
Where the
That outlet area, right. The obtuse acute shape. All right, so once again, formed by the fusion of those 3 to 5 rudimentary vertebrae. That does vary, by the way, between people, believe it or not. Some people have 3 sacral segments, some have 5. Doesn't really make a difference in the size of the person. It's just how the anatomy decides to form, which we'll see when we get to the sinuses on the skull. People have different numbers of sinuses as well. It's just random. Doesn't make a difference. Doesn't change height or anything like that. It just changes. Occurs inferiorly and anteriorly with articulation with the sacrum. That's the coccyx, by the way. Anatomic features are cornu on the coccyx as well, but the cornu on the coccyx is basically going to be in the same spot as the sacrum. We'll show you on a lateral view here in a second. So the cornu kind of overlaps between the two. Remember I told you the cornu is kind of in this spot right here? We're going to see that the cornu overlaps between the sacrum and the coccyx. It's on the back, so we can't see it yet.
How many bones make up the coccyx?
3 to 5. 3 to 5. And that's just random between people. Not going to contribute to height. Coccyx is there as a support, by the way, so you can sit on your bottom, believe it or not. And, you know, if you're really bad at skating like me, It hurts really bad when you fall on your bottom and bruise your coccyx, bruise your tailbone. No one's ever hurt their tailbone, cracked it before? It's painful. I got really bad balance, so when I used to go to the skate rink, I'd always fall. I used to always feel like I bruised my backside, like it was always hurting. I'm a terrible skater.
Why did you go back then?
That's all there was to do when I was growing up. That's all there was until I was a skate rink. So.
My cousin's husband is the
Did he? Ooh. It's painful.
It's the articular process.
It's
I
painful.
can barely walk.
All right, guys, there's another view from the side, so we can see some more of that anatomy. Now we can make out those articular processes. Keep in
There you
mind,
go.
these articular processes do unite with L5. Therefore, there is a zygapophyseal joint between L5 and S1. But that's what these are. There are no inferior articular processes on the sacrum. Yes?
So then, is it still appropriate to call it superior articular process, or could we call it the sacral?
We still call it superior because it's at the top.
Okay.
On the top of the bone. Now, there's that promontory once again, guys. Now, I know you still see the word base, but I want you to know this entire spot as just the sacral promontory. It's how we're going to label on an x-ray. We're not going to differentiate between base and promontory. Just know it as promontory. So this top part and this part right here. But you see how the curve changes from the lateral view? This is not the promontory up here. That's the processes. Promontory is going more anterior on the lateral view because the way that sacrum curves in that shape. We do have the auricular surface that we see on the side, kind of like the wings a little bit, almost like the ala. Actually, those are called ala, same as the pelvis. And then we have the sacrum itself, and there's those cornues I talked about. So these cornues are kind of like two little horns. I said there's some overlap on the sacrum and coccyx. We have a sacral cornu coming down, coccygeal cornu going up, like two little fingers coming together. You can barely see them on an x-ray. So only if you can really make those out on an x-ray will you ever label those. It just depends on the quality of that x-ray. I think I have some pictures to show you coming up. So it's two little areas right here where they, with like little fingers connecting. The bottom of the sacrum is the sacral cornu. The top of the coccyx is the coccygeal cornu. And the whole structure we just call the coccyx. So based on that picture right there, is that a male or female sacrum and coccyx? Can't really tell, right? You actually can't tell. When it's free, you can't tell because you don't know how they laid it on the picture. But when we see it in comparison on a pelvis itself, that's when it's going to make the difference. See how it's connecting on the male or female pelvis. There's the coccyx a little bit closer. Now you will see it does say it has transverse processes. You don't need to know that. It's just showing you that they are there. They're itty bitty. I mean, you can barely, like, the coccyx is very tiny, guys. You're not going to be able to see that. Super small, but they do exist. There's your little segments that goes from 3 to 5, by the way. But we do know there is a base and apex on the coccyx, just like the knee, just like the patella, top part base, bottom part apex on the coccyx itself. Very blown up picture. The coccyx is itty bitty. In fact, I have a picture showing you how small it is in a second. But very painful when you bruise it or break it. Also, a very old school palpation point. Do not palpate your patient's coccyx. That's not going to be appropriate. That's not going to end well. But back in the day, I had a very elderly tech who I worked with as a student. She would still palpate the coccyx on her patients. She'd just jam her hand in there and go to town. But not what we would call an appropriate palpation point. We got other alternatives we can use that are more appropriate. So keep that in mind. And there you go, guys. There's a postage stamp. That's how small your coccyx is.
Oh, that's a Cheeto Puff.
Cheeto Puff. That is a human coccyx in comparison to a stamp. Very, very, very small. A little bit longer than an inch. Now, what's it look like on an x-ray? Ooh, that's a bad quality image. I'm sorry. Well, this would be an apiaxial sacrum x-ray that we're looking at. We have the top part once again. Can y'all see that well enough? That border, that long border, that's going to be that sacral promontory at the very top. SI joints on the side. Cornu is where the sacrum connects to the coccyx right here. And there's those sacral foramina. Not as pretty circles as we saw in the diagram, but we still can still make them out. And coccyx is down here. These x-rays are notoriously kind of ugly if you've ever done them in clinic. Usually because, believe it or not, a lot of people come in for sacrum and coccyx x-rays saying they have pain in the area, but they actually just have a lot of gas and constipation. They're just really backed up. You think about the large intestine, the sigmoid and rectum is in this area as well. So if they're really gassy or they have a lot of backed up feces they need to eliminate, they can actually cause a lot of pain in that area if they're just really hurting the intestines. So you'll see a lot of times when you do these, instead of this pretty image you see like this, you'll see just a bunch of black blobs right here covering up the whole area. That's usually when they can be like, well, that's the problem. There's nothing wrong with the sacrum coccyx. They're just gassy or they need to go to the bathroom. Take a laxative.
Okay.
Question?
So the apex will be right above that joint of
Yeah.
coccyx?
Yeah, so apex is right here, base is right here. That's an ugly picture. I think I got some better ones coming up. Well, I thought they were better. It's still a little blurry. They're ugly X-rays. They're not the prettiest X-rays. This is a coccyx X-ray. This is a sacrum X-ray, and we're going to find that we do two different views on those. If you've looked ahead on your positioning, there's two different angles we're going to learn for sacrum versus coccyx. For the sacrum, we're going to angle cephalically. For the coccyx, we're going to angle caudally. Reason being, depending on the star of the show, we want to elongate that bone because of the natural curvature. If we shoot just perpendicular, we're not going to get a good view of either bone. It's going to look like it's almost superimposed on itself slightly. So over here, we have the coccyx elongated. Therefore, this was a cephalic angle of about 10 to 15 degrees to elongate our star of the show, as I always say. Here's our coccyx. That'd be the base, apex, cornu about right here. There's our sacral foramina, which you can barely make out. There's our SI joints. On the right, this is our sacrum X-ray. Even though we can still see the coccyx, the sacrum is now much more elongated. This is the new star of our show. And I know it's really blurry, but looking at the anatomy, there's the promontory at the top. There's the SI joints, followed by the foramina that we can barely make out on the sides because it's very bad spatial resolution. There's the coccyx, top is the base, bottom is the apex. But once again, what did I say? We got to freshen up on that pelvic anatomy as well because look what all we can see down here. Do you remember what these are called? Do you remember what this is called right here? Superior ramus, superior ramus, inferior ramus. The what ischial tuberosity, very good. That joint there is called what? The acetabulum, very good. The what of the femur? That circle's called the brim. What kind of, is this male or female pelvis?
The female.
How do you know it's a female?
We think it's big.
That wide angle there, guys. Coming back a little bit. It's been a while. It's been a while since we thought about the pelvis. What are the three parts of the pelvis, by the way? Ischium, ilium, ischium, pubis. Okay, what's that joint in the middle called? Pubic symphysis. And how about those two holes, the little eye holes? Arterial foramina. You know, just off of Mardi Gras, this is the Mardi Gras mask, right? There's going to be a nice lateral view, guys, where we see our sacrum and coccyx. This would be a lateral sacrum and coccyx X-ray. Typically, when you do a lateral series for either sacrum or coccyx, you go ahead and include both on there. You're not going to do one or the other on the laterals. So, very easy to see. Here's our sacrum. What is that little triangular point called? The promontory. There's that promontory. Promontory. And if you look very closely and squint your eyes, maybe the TV screens are easier to see. We can make out the two cornu just barely. Look, two little bumps here. See them?
Oh, yeah.
That would be the sacral cornu. This would be the coccygeal cornu. But once again, that depends on the quality of the image. You can't always make that out. This is a little higher quality, believe it or not, so we can actually see those little prominent bumps and label those accordingly. Coccyx right here, top of the coccyx is the base. Bottom, once again, is the what? Apex. And what is that notch called? We talked about it in the L spine.
The
Sciatic notch.
sciatic notch, yeah.
Y'all are tired today, I can tell. Like it's going in one ear and out the other.
It's like peanuts on Charlie Brown.
Now, I included this because on both registries I've taken, both X-ray and CT, I've seen an image just like these, where they give you an X-ray of an actual singular vertebrae. And they'll have some letters on it just like this and say, what is B, what is A, what is F? So we're gonna review that. Great picture to take, by the way. I don't think that's in your book. something good to reference. Let's start with the image on the left, where we're looking down at a vertebrae. And this is, well, first off, what kind of vertebrae is this? It's an L. How do we know it's an L and not a T? The biggest indicator is this right here, guys. See that fin shape? It's not pointing and down, it's that wide fin shape jutting straight out. But let's go back to the left image. What is letter A, guys? What is letter B? Lamina. Lamina. That's the lamina. What is letter C? We knew that one, okay. How about letter D? Vertebral foramen, not the intervertebral, it's the vertebral foramen. Don't mix that up. E. Let's go to the lateral view. What is letter A? Letter B. He's got a little cheat there on that one. Inferior vertebral notch. Letter F.
Pedicle.
Pedicle. Letter E.
Superior articular process.
Letter C.
Inferior articular process.
Letter D.
Spinous process.
And we can't really see the superimposed, but what's superimposed right here?
That's the pars
Inferior
inferior.
Not the pars, because we can't see it on lateral. There's another thing that comes out on the sides.
Transverse.
Transverse process, letter F right here. It superimposes on itself on that lateral view.
Would the pars be more like inferior to that?
Pars is going to be more so, like, if I was looking down this way, it'd be about right here.
Can you try that again from the other side?
Like if I was looking through this way,
Yeah.
it'd be kind of like in this groove right here.
Okay.
Yeah. Yes.
So which views can you see the pars
So the pars interarticularis, you're only going to ever make out X-ray wise on an oblique. If we're looking at models, we can only see it from behind. Good question. All right, another AP view here, guys. What is letter F specifically?
It's L1. F is in
This
but it
space
gets space of
of
L1
1 and 2.
Intervertebral disc space of L1 and L2. Can y'all see that? Remember when I said to count from the top on the APs? Y'all see the last red? That's T12, 1, 2. Therefore, it's the intervertebral disc space of L1, L2. What about letter D? Now, you can't always see these on our APs. We give you a nice, pretty outline there. What do you think that is? Inferior articular process of what? Very good, L3. L3. So, what would E be? Superior articular process of
L4.
L4. What about letter C?
The spinous process of
L4. L4. Letter A.
Transverse
Transverse process of L5.
Which one though?
Right?
The right transverse process of L5. Zero right and left.
Good job.
And letter B is just referring to the whole block. What is letter B?
Huh?
Body of L4. Body of L4. Now, if I pointed right here, where's that little circle?
Pedicle, the left side.
The left pedicle of L2. Left pedicle of L2. What are those muscles on the side called? What is this entire bone called?
Sacrum.
What is
Sacrum.
this? The sacrum. The top of the sacrum here, the line is what? Sacral promontory. Those little holes are called what? Sacral foramina. Gotta be specific. The two joints here and here are called what? What part of the large intestine is this?
The roma.
Transverse. Good.
Oh, the transverse.
Let's throw that one in there. Very good. So once again, believe it or not, a lot of the so-called back pain that people suffer with, more often than not translates to colon pain because they're backed up, they gotta go to the bathroom, they're gassy, or kidney pain. Like if they have kidney stones or other stuff wrong with the kidneys, that's a lot of our so-called back pain that people complain of. But they'll usually go ahead and do that L-spine first, unless they know something else going on. Yes, question?
I missed out on the fourth body. Which one did you point at?
Say
Did
again,
you
I'm
say
sorry.
the fourth body? Did you point at a body over there?
This right here?
And that was the fourth body.
Yes. The vertebral body of L4.
Which, that's easy. There's none
It's
of
letter
the
B.
labels, right? Or B.
Letter B.
B. Thanks, sir.
You're welcome. Alright. Let's see what we can label here. There's a nice, beautiful lateral L spine.
5, 4, 3, 2,
What are we looking at on letter A?
1. L1. Body
What
of
are we all mumbling that for? That's an easy one.
You said body of L1.
Okay, okay. That's a little louder. I can't hear. Body of L1. Body of L1. Get a little oomph behind it. Be confident in your answer. Like, body of L1. Maybe if I get it wrong, you won't hear me. What is letter B, everybody?
Body of L3.
Or the train.
Oh,
be
the
the-
door, nice.
It's the body of L3. Body of
Oh,
L3.
just the body.
So,
Oh, you're not pointing to that little circle?
no.
That's not a pedicle.
Yeah, that's pointing to the little circle, so
It's
The little
gas.
circle is gas.
That's gas.
Yeah.
The pedicle is here, guys. It's a lateral view. Yeah.
You said
What about letter E?
Just said there's a pedicle.
Come on, Cody. Come with it, Cody.
You said
Yeah.
Inferior,
Intervertebral foramen.
inferior.
Just point to the circle, guys.
The intervertebral foramina of L2 and L3.
Intervertebral foramen of
L1 and
L1 and L2.
Okay, my fault.
L1 and L2. Now remember, I want y'all to remember, guys, because I heard some of y'all saying articular processes. Remember, that's not the star of our show on a lateral. The star of our show are the foramina. The foramina. We're not focused on the joints here, just the foramina and the disc spaces. So, speaking of disc spaces, what is letter C?
The space is L5, 4 and 5.
Vertebral disc spaces L4 and L5. Letter D is pointing to the block again. What is that?
Body
Body
of
of
L5.
And what is this all-important joint here?
S L5 S1.
SI.
Not S1.
L5
S1.
S1. This point here is what? Sacral promontory. This whole bone's called the what? What about this specific fin coming out back here?
Spinous process.
Of
L3.
L3. Spinous process of L3. A little hard to see, but can y'all see them? Little fins. And y'all see the notches. Notches are a lot easier to identify on lateral. So this would be the inferior notch of L3, superior notch of L4. Is it clicking a little bit?
So we finish the pedicle.
Well, pedicles are right here, guys. Pedicles are here, 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 here. 1, 2, 3, 4, 5.
I feel like you can see the zygopathocele joints on this.
You can barely see them, but once again, that's not our focus on the lateral.
For sure, but you can't really see them on, like, in this spine. Like, I feel like you can't see them at all.
You can't. See, so L spine, because they're so much larger, it's gonna be a little easier to identify those individual parts. So I said, you know, L spine overall is a little easier. It's less vertebrae, and those parts just really kind of pop at you
There's
more.
no ribs.
Hmm?
I said there's no ribs.
No ribs in the way, correct.
Could you point out the transverse process and the pedicles?
You cannot see a transverse process on a lateral. It's
Well,
superimposed.
Where they would be then?
Not right here.
Okay,
My hand's
so
shaking, sorry. That's where B's pointing approximately, actually. That's where it's superimposed. And then the pedicles are right behind. It's basically connecting the body to that process.
so you wouldn't ask then if B was the superimposed transverse
I would not.
process or just
That'd be
the
really
body?
mean of me. Don't give me any ideas. Get me in a bad enough mood, I might
I'm
ask
looking
that.
at- I'm looking at this one on L4 and I couldn't really tell if you wanted the body or.
So just remember, just think about what we can actually see, what are we focused on per view. Transverse processes do not concern us on laterals, only on APs and obliques. Question, Johns?
Why are the spinous process so like hard to see?
Because think about where all the x-rays are going. And look at the bone. Look how thick the central portion is and the front is compared to the back. So think about absorption, attenuation. The beams are hit and miss primarily, which is gonna make that kind of fade away in comparison.
Okay.
Throw you some PRE there, some attenuation factors. All right, nice, beautiful AP, L spine. What is letter A?
T12.
It's basically T12, correct. I thought I was gonna get some of y'all there, but That's just T12 or the body of T12. Wide, you see the ribs? Once again, there's the 12th rib. So if that's T12, letter B is going to be what?
L1.
Letter C is going to be,
L3.
letter D is going to be L5, and specifically on L5, what is that pointing to? Sinus process.
Oh, wow.
Okay. Yeah, my foot actually got like stuck on the ground. I felt like there.
You know what?
My feet are
Just
sticking.
have a seat and just
Yeah,
wheelchair. Just wheelchair.
We still need you.
That was interesting. Okay. I think I put my foot got stuck.
We need you till 2024.
At least.
It's Friday.
You wanna take a seat?
Go home early.
You wanna take a seat?
I'm good. Seriously, I'm good.
Yeah, almost got.
Just step. So I have 2 left feet.
Imagine you
All right,
could
spinous
sit
processes, guys. Once again, little circles are called what?
You said it.
Pedicles, left and right. You can barely see them before we see our protrusions on the sides. What are those called?
Transverse process.
And I almost fell. Let's refocus. Transverse processes. I trip a lot, guys. I actually do.
No, this is the first time I've ever seen you trip. I've seen you trip before.
Oh,
I got 2 left feet. I trip all this stuff.
I want to see those X-rays.
Huh?
You got 2 left feet.
That's a saying.
Where's the accession? Where's the accession number? Come on now.
That's a saying. You know, you say people like can't chew and walk gum. I chew and walk gum. I gotta need to stop. Walk and chew gum. They can't walk and chew gum at the same time. That's me.
I walk my gum personally.
Now, the all-important question: what are we looking at per oblique? So, really great news. It shares the same concept as the T-spine. When we do our LPOs and RPOs, we're looking at the downside joints. Oh, yeah, that's the back. It's not the front. Can you tell? I always that picture someone Teresa always throws every class off. That's the spinous process in the back, like we're laying down. LPO, RPO shows the downside joints. REO, LEO is going to show the upside joints. Same as those T spines, opposite of the C spine. I think I got a really cool little thing for y'all coming up.
Oh, can
Yeah,
you
after-
go back, please?
Yeah.
So oblique is beside the prophyseals, and then
Oblique shows like apophyseals, lateral show foramina.
So, which one is the one that we're looking at on our worksheet? I'm trying to figure. Is this CRs?
So I can tell you one thing, Jay, if you want to know what oblique is on there, it's always going to be LPO, RPO. I'll tell you why. Optimally, we're always, even if the patient is in pain, going to do LPO, RPO, L spine, as opposed to the REO, LEO, because of one major factor, the OID. We want that spine as close to the film as possible. If we do the opposites, the REO and LEO, we're creating a lot of extra OID.
So you want us to label it as
If you ever see
LPO?
an X-ray or an oblique, you always assume it's an LPO, RPO, period.
Okay. Because it looks like the CR is coming from the posterior aspect on here.
Way overthink that. Way overthink that. Just trust me on this.
Okay.
I have never seen a tech in my life, nor I think will I ever see a tech do an REO, LEO, L spine. It's just not, it's not feasible. It's gonna really downgrade the quality. It's just, it's not good for the patient either, especially if they have really severe back pain.
so on the downside, we're looking at upside.
On the, wait, what?
Like
The side that's down for LPO and RPO, that's the joint we're looking at. So LPO, you're looking at the left joints, RPO, right joints. But if we were crazy into these other ones, LEO is gonna show the right, REO is gonna show the left.
What do you mean by
so
the
RPO
side?
shows the right.
Side that's touching
The side that's touching the
table.
wall.
Side that's down.
So my backside, that's.
So? That's just showing you what those xylopopsyl joints will look like, guys, when we're positioned properly. This is a very bad x-ray, by the way. This person's centered way too high. We're not even including all the L spine, but we can see our nice open joints. That's what we do want to see. Now, there's something I'm looking for I want to show y'all. Oh, let me quiz y'all on this real quick before we get to that.
Y'all are on this minute today.
All right. So, oblique L spine. Let's look closely because we don't have our nice outlines anymore. What is letter A pointing to? It's pointing to the ear, by the way.
Prophyseal joint, right?
Ear.
The superior.
Superior articular process of, let's go, 5, 4, 3.
The third one.
Superior articular process of L3. B would be the what? It's still pointing, but it's not on the joint. You see the joint?
It says
So
behind
the
it.
point right there,
Inferior.
inferior arterial process of L2. E is pointing to the eye, by the way.
Which is the pedicle.
Pedicle of L3. C is doing the same thing, it's pointing to an ear.
Superior.
Superior arterial process of L4. D would be
Inferior.
inferior arterial process of L4.
L4, L3.
3, sorry. I do need to sit down. L3. We're gonna review this again on Monday, don't worry.
It's because you spilled your coffee.
I'm gonna blame it on the spilled coffee. F is pointing to the eye again. What is that?
Pedicle.
L4. Now, if I pointed to this little space specifically, what is this?
Zygapophyseal of L4 and L5.
Zygapophyseal of L4, L5. If I was pointing to the nose here, what would that be?
Transverse process of L4.
Very good. What if I point to the neck right here?
Pars
Pars
articularis
articularis
of
of L4. And the body portion? The lamina. Very good, very good. Once again, guys, if there's anything you want to master, it's these oblique L spines with these sky dogs. This will be on your registry. Multiple questions. No doubt. It's not that bad. It really isn't. All right, I want to jump ahead here for a second because I want y'all to take a picture of this. This is what we're going to end on today.
Fried chicken.
Y'all been having trouble with this stuff, so I found this beautiful little thing for you right here that shows you what you're looking at between the downside and upside. So I thought this was kind of cute. The oblique lumbar hint. Use the southern drawl. You know, fresh fried chicken, crispy curly fries.
Hold.
Fresh fried chicken, crispy curly fries. You gotta say it like a
Say it
true
like you mean
Texan.
it.
I don't know if I did the Texan accent right. I'm not from Texas, but you can assume I did. So C spine, foramina are farthest. T spine, zygapophyseal are farthest on the posterior obliques, by the way. You'll see how I did it there for you. L spine, zygapophyseal is closest. Anterior obliques, foramina closest, zygapophyseal closest, zygapophyseal farthest. Anterior obliques.
Mr. Donnie, how come you don't have a Louisiana accent?
I've spent years calming it down. And really it's because of my wife. She told me, because I used to have a really thick accent, she told me, she said it's cute, but people won't take you seriously if you talk like that. People get the stereotype like, oh, he's just a dumb country boy. Which is sad but true. A lot of people do. So I've spent years trying to
Post-colony.
fix my speech, so to speak. If I ever go visit my parents though, it comes out really bad. Yeah.
But you do this a lot, like,
Huh?
whenever you speak, you always.
I thought.
Yeah, you do like that.
The lisp.
Yeah.
What?
Okay.
She's like, minus 10 points for you, girl.
All right. So we'll hit this again on Monday, guys, because it's very important that we make sure we master this. When did I have y'all's next group activity?
Play-Doh?
Syllabus. You want to have the syllabus nearby? The Wednesday? Just want to make sure I have it for the Wednesday.
Mr. Donahue, before you end, just one question. What do you mean by C spine, foramina and closest? What do you mean?
March 1st.
It's for an anterior oblique, REO-LEO. What foramen are we looking at? The one closest to the IR.
Oh.
Versus the posterior obliques, it's LPO, RPO. We're looking at the foramina that are furthest away or the upside.
March 1st.
So Wednesday?
Yeah.
Okay, just making sure. All right, so do go ahead and start practicing that anatomy, those worksheets. We'll review those on Monday as well. Make sure you have the correct answers. We'll continue on some more anatomy practice and start segueing into the positioning aspect. And I am going to work with you guys a hot spot practice exam together as well.
Thank you.
So practicing how that will work on your test. Sound good?
Beans.
Yeah, don't go anywhere.
I'm here. I'm sitting down. I'm going to sit down. I'm sitting down.
Oh my gosh, yesterday I think I forgot this country. You know how like for I think I can't remember if it was C-spine or it was something that like I worked, but
The way he said it was so like, oh my god, why would you say it like that? Like,
Yeah, it was funny.
yeah, 'cause she had a wig
Oh,
on.
Wait.
okay.
And I was like,
That
why
would
did
be
you
awkward.
say it like that? How did
What
he
did
say
he
it?
say?
So
He
funny.
was just like, can you take your wig off?
Can you take your wig off? Yeah.
Was it Charlie?
I mean, he said what he said.
Was it?
How's
Nana?
it rude?
Nana?
What would say
Well,
that?
they
She
told
said-
us to say, do you have any removable
He made her take the whole
Just say,
thing
do you have any
Um,
clips in your hair?
hairpins or
Oh,
pieces
they said they might
like that?
Yeah, just say you have
He
any
walked
clips in
right
your
in, he was
hair.
like, I'm gonna need
And
you
they'll
to
say,
take
oh,
it
I have a
off.
wig.
There is.
Yeah.
And I was
Dang, I would've gotten patient care knocked for that.
That's how
Like,
you
girl,
say,
take
"Do
your
you have
weave
any
off.
clips in your
So
hair?"
she had the
And they'll
combs
say, oh,
that had the
I have my
combs in it,
wig.
and you
Oh,
can
you're
see
not
the
taking it
combs.
off.
Oh, okay.
That's how you say any clips.
So that's how he knew. That was funny, wasn't it? Reagan, that wasn't funny.
And then everybody got side.